Action News reporter Jane Park outside Children's Hospital tonight with the latest in the fight against this outbreak.
To put this into perspective, enteroviruses are fairly common. They turn up during the summer and fall, but doctors say this particular strain spread quickly and it has already claimed the lives of half a dozen children, including young Madeline Reed. And doctors say prevention is key because there's no targeted treatment or vaccine for it. 21-month-old Madeline Reed of Clinton Township is the latest victim to succumb to Enterovirus D68, the first reported death in Michigan. According to a GoFundMe page created for Madeline last month, the toddler was on life support since mid-September. The illness caused congestive heart failure and damaged her nervous system.
That made it very difficult for her to get the blood supply and the oxygen to all the parts of her body.
The Centers for Disease Control and Prevention says there are nearly 700 confirmed cases of the virus across 46 states, with likely many more milder cases. Dr. Matthew Davis, the state's chief medical executive, says there are over 100 different types of enterovirus. Adults can build immunity and protection against them, but young children who haven't had the benefit of exposure can be at risk of experiencing more severe symptoms.
This particular strain of virus has become easier to spread this year, and also there may not be as much protection that children have against this particular strain.
There's no particular medicine or vaccine to fight EVD68, making treatment more complicated. And while Dr. Davis says hospitals across Michigan are seeing fewer children being admitted with respiratory problems, there are now more cases of muscle weakness and partial paralysis, which doctors say could be linked to this enterovirus. What can we do to prevent the spread of the virus?
Careful hand washing with soap and water, covering our coughs and sneezes, keeping ourselves and our kids home from either work or school if we're sick so that we don't spread this virus to other people.
In the meantime, Dr. Davis says a network of 90 Michigan hospitals are closely monitoring further cases of the virus and constantly sharing information to help doctors treat patients during this outbreak. Enterovirus D68 spreads like the common cold through sneezing and coughing and direct contact, so good hygiene is one sure way to protect your children. Of course, doctors say most people won't develop severe symptoms, but if your child is experiencing difficulty breathing, you should seek immediate medical help. Reporting from downtown Detroit in front of Children's Hospital, Jane Park, 7 Action News.